All right, I think we can get started. I think some more folks are on their way in, but we can admit them as we go. But I just want to open up by welcoming everyone. We're so glad to have you all here joining us as we kick off Sepsis Awareness Month for 2024. I'd love to hear who's in the room. So if you want to use the chat and just share who you are, where you're from, that would be great just to hear from everybody, since we are a pretty full room today. And so we won't have a chance to hear from anyone verbally, probably. But before we begin, just some quick logistics. We are recording today's presentation, so your microphones are muted, just to minimize the background noise. You may choose to keep your cameras on or off, but if you leave it on, just know that your image may then become part of that video recording. We will be able to take questions at the end of the program as long as we have time. So please just enter any questions that you have into the chat as we go, and then we can come back to them as there's time at the end. Today's program is a little bit different than many that we typically offer at Sepsis Alliance. Typically, we'll offer virtual programs to various more specific groups of people. So, for healthcare professionals in Sepsis Alliance Institute, for people that have been personally impacted in Sepsis Alliance Connect, or for advocates in Sepsis Alliance Voices. But Sepsis Awareness Month is really a time when all of those groups of people can come together for the common goal of raising awareness for sepsis. And as such, today's program is really for everyone. So we hope you'll enjoy hearing about initiatives that we can all be a part of together, as well as ways that maybe other folks are getting involved this Sepsis Awareness Month. Now, I'm pleased to introduce all of our presenters today, who are all my colleagues. I'm Megan Jones, the Senior Community and Content Manager. And today I'll be joined by Julie Hedgebeth, the Marketing and Communications Specialist, Hannah Sass, our Senior Provider Education and Training Manager, and Kate Wasson, our Senior Advocacy Manager. And it is our hope that by the end of today's presentation, you'll be familiar with all of the ways that you can be involved with Sepsis Awareness Month this year. So what is Sepsis Awareness Month? Sepsis Awareness Month has been around since 2011. It takes place every September. And in 2011, Sepsis Alliance was actually the ones to declare September to be Sepsis Awareness Month. And during this month, we invite individuals, healthcare professionals, and organizations, big and small, to help save lives by raising awareness of the leading cause of death in US hospitals, which is sepsis. And this annual observance coincides with World Sepsis Day, which is September 13th. Why is it that we think sepsis awareness is so important? And the big reason for that is that sepsis is a public health crisis. Here in the US, there are at least 1,700,000 cases every year. And of those, 350,000 adults unfortunately die due to sepsis. Sepsis is a leading fatal complication from COVID-19. And like stroke, it's a medical emergency that requires rapid identification and treatment to save lives and limbs. And of course, it's hard to respond to something rapidly if you're not familiar with what sepsis is and what it looks like. We often think of sepsis as something that might, strike when you're in the hospital, or strike really older folks or younger folks, or that kind of thing. But sepsis really can affect everyone. Those who are most at risk are the very young, those newborn and premature babies, those with chronic diseases and immune compromising conditions, older adults, and also the medically underserved. So people who are in lower income neighborhoods, rural communities, and parts of racial and ethnic minority communities. But like I said, anyone can get sepsis. And so it's really important that we all make sure that we are aware of what sepsis is, what it looks like, and we're spreading the word to those in our own communities as much as we can. When we talk about sepsis awareness, a question that we get sometimes is how are we defining it? What do we look at as success? And obviously, awareness of sepsis can have lots of different layers of familiarity. And what we hope that a layperson on the street is familiar with is very, very different than what we hope a medical professional is familiar with when it comes to sepsis. But when we do our annual sepsis awareness survey, as an example, something that we look at pretty frequently is just recognizing and being able to define what sepsis is. So a definition we like to use that we think is pretty easy to grasp is that sepsis is a life-threatening emergency that happens when your body's response to an infection damages vital organs and often causes death. And then getting into the being able to recognize sepsis or to know what signs and symptoms to look out for. We use the time mnemonic as a really accessible way to remember those symptoms that we want to look out for quickly. So just like stroke has a mnemonic to help folks remember what might raise the alarm and what might cause them to seek care, we use time. And so time stands for temperature, higher or lower than normal, signs and symptoms of an infection. So whether that's a bad sore throat or a cut or a surgical incision that looks like it might be infected. Mental decline. And so this can look like confusion. It can also look like someone is just extremely sleepy. We hear so often really troubling stories of folks that felt really unwell and decided that they wanted to try to sleep it off for a while, and that was a decision that they later came to regret. And then E stands for extremely ill. So the sort of severity of all of these things being, they often people describe as the sickest I've ever felt in my life, the worst pain I've ever felt in my life. People will often describe the feeling of really, being really afraid that something was terribly wrong and that they might be close to death. One more thing I wanted to point out at this point of the presentation is that it can be hard sometimes to bring up sepsis to folks when you're just walking around going about your life. And so something that we've found is really helpful to folks is having some sort of physical items that might serve as an icebreaker. And so sometimes that might be a button you can wear or a tote bag you can carry or a mug to have at your desk with your morning coffee. So all of these items are available during Sepsis Awareness Month. We'll share the link to our shop in the chat in a little bit, and also in the notes from today's program. But you can also use that QR code that's on your screen right now. All right, and then with that, I'm going to pass it for a little bit to my colleague, Kate, who's going to talk about our Sepsis Awareness Month presentations. Go ahead, Kate.
Yeah, thank you, Megan. So one of the advocacy initiatives that we have is requesting Sepsis Awareness Month proclamations. And so I'm going to talk a little bit about what that means and how you can request a proclamation. So proclamations are used to recognize special events, occasions, or achievements within your state. And so they're usually issued by the governor, although sometimes other state officials can issue them. And they designate specific days, weeks, or months for the observances. So for example, September, as Megan pointed out, is Sepsis Awareness Month. And the goal is to raise public awareness about a specific issue. For example, sepsis awareness in September. And so these proclamations, they recognize and honor the achievements and contributions of individuals, organizations, and communities, which foster a sense of pride and appreciation. And so we're going to talk a little more about that and why we have proclamations and why they're important. And the next slide. Yes, awesome. So here is why it's important to have September as Sepsis Awareness Month. So first, it's recognizing the awareness. And so as Megan said, sepsis is a life-threatening condition, and it can be difficult to recognize. And so by having September as Sepsis Awareness Month, it helps to educate the public and also healthcare professionals about the signs and symptoms, time, like Megan said, which can lead to earlier detection and treatment. We also understand that the early recognition and treatment of sepsis significantly improves patient outcomes. And so an increase in awareness can lead to quicker medical responses, which can in turn save lives. We also really care about reducing mortality. Because sepsis is a leading cause of death in hospitals, awareness efforts can contribute to reducing that mortality rate and encouraging prompt medical attention and adherence to the best practices. Now, it's also a public health priority. And so by highlighting sepsis as a public health priority, Sepsis Awareness Month encourages the allocation of resources and support for research, prevention, and treatment efforts. And we're going to talk a little bit about how Sepsis Alliance is working on that in our advocacy efforts. And lastly, it's empowering patients and families. And so these awareness campaigns provide crucial information to patients and their families, which empower them to advocate for timely care of sepsis if it's suspected. And I'll tell you, my best friend, her dad had sepsis and is thankfully alive today. And she requested a proclamation for her state, and it just got to her dad this past weekend. So that was really important to him. And it really did empower them to continue their advocacy efforts. And so here are our current numbers. We have 26 states and counting. This map is available on our website, and it is being updated almost daily. So we're getting those proclamations in. And we're going to talk a little bit about how do you request a proclamation from your state. So the first thing you're going to want to do is find your governor's web form, and that'll be on the state website. You can do a quick Google search. And once you find that information, you're going to check your state's deadline. A lot of these states we've noticed have a 30, 60, even 90-day waiting period. And that means that you have to wait, or you have to submit your proclamation request at least 30, 60, 90 days in advance. And that date for Sepsis Awareness Month is September 1st. So once you check that deadline, you're going to fill out your contact information. And that is super important because that's where they're going to mail the physical copy of the proclamation, which is super cool. And then you're going to fill out our organization information, and then you're going to fill out the proclamation details. And so we wrote all that information for you, what you would copy paste when you submit your proclamation request. And that information is going to be what's on the proclamation. So it talks about why this is important, what Sepsis Awareness Month is, why we have it, things of that nature. And for a step-by-step guide, I think Julie just put it in the chat, but it is on our website, and we have a state-by-state specific guide as well for your individual state. So that's really exciting. And lastly, we are working on a Hill Day next week. We are going to be at Capitol Hill. We're doing a congressional briefing where we'll have some panelists discussing their experiences with sepsis, the importance of this legislation that we're working on. It's called Lulu's Law. And then we're going to be having legislative meetings where our advocates are going to meet with lawmakers to discuss their experiences, sepsis advocacy, and push for legislation. And so that's really giving us an opportunity to talk to lawmakers about why this is so important, about September being Sepsis Awareness Month, and the like. So this is going to be very, very exciting, and that'll be next week. So look for some information and some of the highlights from that day. So thank you. I'll pass it over to Julie.
Hi, y'all. I will be glad to talk to you about the Sepsis Superhero Challenge today. And as you can see, this is our 8th year to do the Sepsis Superhero Challenge. And basically, this is a very easy way for you to get involved and spread awareness in your community. And it's also a fundraising event for us as Sepsis Alliance so that we can keep spreading this message and raising awareness and providing educational programs. And so we're really excited to share this event with you. Basically, for the Sepsis Superhero Challenge, we encourage you to do 1 mile of your favorite activity. We've had everything from walks and runs, swimming, hula hooping, any type of activity that you want to do helps raise awareness. And for each mile that you do, when you do your mile, you can ask your friends and family to sponsor your activity and help support Sepsis Alliance. And you can see to register to do this, you can go to sepsissuperheroes.org. You can create a team or you can participate as an individual. So if you and everyone you work with want to create a team and have a run at your office, then we would love to have you. Also, it's not too late to join. So if you sign up today, you can go ahead and join, register, plan your event, and we'd be very excited to have you. I'm going to share a few details about the superhero challenge because I know you're like, oh my gosh, an event running, that's a lot to take in. So we've put together a very handy fundraising toolkit. It's this blue document right here. You can download it from the Sepsis Superhero website, or you can scan this QR code to download it right now. And it will tell you everything you need to know about how to do a mile of activity, give you sample messaging to send to your family and friends to ask them to support you. We really have everything you need to get started right now to do this challenge. And it's great for spreading awareness and providing education for people. We have things that you can share with people to help express why you personally are interested in doing this challenge. So I really encourage you to download this document and get started. And did I mention that we have prizes when you participate? You can earn superhero swag by raising funds. You can, if you raise $100 or more, you get a sepsis awareness superhero drawstring backpack and 10 time cards to share with people. If you raise $500 or more, then you receive one of our 16-ounce sepsis superhero tumblers. And if you raise $1,000 or more, you get to one of our folding chairs with our carrying bags and the fun Sepsis Superhero logo. And like Megan said earlier, these are great items to get people to have a conversation with you about sepsis, and they're also really fun. So I hope that you will join us in being a superhero this September. And please let us know if you have any questions about the challenge as well. The other really easy step that you can take to get involved in Sepsis Awareness Month is just sharing our resources that we have on social media and with your family, friends, anybody that you know, coworkers. We've put together social media graphics, flyers, and more that you can download straight from our websites at sepsisawarenessmonth.org. And we just ask that you should tag us in your posts so that they continue to get the education that we provide on social media and get updates about all the stuff that we're doing. We are on LinkedIn, Facebook, Instagram, X, which is formerly known as Twitter. So search for us there. If you want, you can do that right now, actually. We're sharing a new campaign this month called Infection Prevention is Sepsis Prevention, and we've already made those posts. If you just want to share that post, that's a great way to get the conversation started and to share sepsis awareness super easily. So we would love to have you make a difference by doing that. If you have any questions, like I said, please let us know. And I think that's it for social media. I'll turn it over to Hannah.
Awesome. Thanks so much, Julie. Hey, everybody. I'm Hannah, and I'm on the healthcare professional education and training pillar of Sepsis Alliance. So my lens is really how Sepsis Alliance can help, can help provide healthcare professionals the education they need to save lives and reduce suffering from sepsis. So I'll just take a couple of minutes to speak briefly to what Sepsis Alliance does to help educate healthcare professionals across the continuum of care and ways that you can get involved in sepsis education, especially during this Sepsis Awareness Month. So you can go to the next slide, Megan. So we offer education around all things sepsis, from Sepsis 101 to specifics about diagnosis and treatment to providing post-sepsis care and support to patients. We provide a forum for healthcare professionals to ask questions of their peers and share their experiences, and resource sharing between providers to continue improving sepsis recognition and care. Sepsis Awareness Month is really a fantastic time to get involved with our education and to share it with your staff. And if you're a sepsis survivor and wanting to get involved, this is a great time to share our educational materials with your healthcare providers. So, to talk a little bit about specifics, we have a learning management platform that I know I see a lot of familiar names here. So hi to everybody that has taken our webinars. This is sepsisinstitute.org, and that provides over 200 free clinical education courses that are accredited for CE contact hours for nurses. And we've got the involvement of 275 subject matter experts who are leaders in their respective fields. And then in addition to our online courses, we provide a peer-to-peer discussion board that is considered a safe space for healthcare professionals to bring their concerns, questions, and experiences with others. And Sepsis Alliance Institute also has a resource library where subject matter experts and healthcare professionals can share and download free tools and resources. In the last several years, we have really tried to listen to our healthcare professional audience of over 50,000 learners to create a platform that's user-friendly and provides the information that healthcare professionals need to actively improve sepsis care. You can go to the next slide, Megan. And go ahead to the next one. I just want to talk a little bit about the upcoming events that Sepsis Alliance Institute is offering. So in conjunction with this Sepsis Awareness Month, we're hosting our annual Sepsis Alliance Summit, which is scheduled for September 25th through 27th. This is our largest virtual event with over 3,000 folks registered last year, and it's really designed to explore the full spectrum of sepsis-related topics, including expert presentations from clinicians, innovation experts, and other influential leaders. And again, this is all virtual, free, and we really think it's a great way to involve your teams in sepsis awareness this September. Go to the next slide. Another big event we have hosted annually for the last several years and which will be coming up again this December is our Sepsis Alliance Symposium, Healthcare-Associated Infections. This is a half-day program on critical topics in the HAI space. The goal of this symposium really is to provide discussion around recommendations for infection prevention and treatment of HAIs to improve clinical outcomes. So again, as Julie mentioned, tagline for this September is infection prevention is sepsis prevention. So certainly recommend you register for this December event. And the last thing I want to mention is that we do have a Sepsis Awareness Month toolkit that is a fantastic resource if you want to get more involved this September. This toolkit includes a number of tools to help your organization showcase Sepsis Awareness Month, including key messaging, sepsis facts, and downloadable resources, as well as social media graphics to share. All right, so thank you so much, everybody, for joining and for furthering the cause to raise sepsis awareness and save more lives. And please feel free to reach out to me with any questions. And with that, I'll turn it back to Megan. Thank you so much.
Thanks, Hannah. One last thing that I wanted to highlight is an opportunity that we have year-round, but especially during Sepsis Awareness Month, to educate your own communities. So, you know, whether you're somebody who has a personal connection to sepsis, whether you're a healthcare professional who wants to spread the word among some more lay people, anything like that, we at Sepsis Alliance have a toolkit that we call Sepsis 911. It's a community education presentation, and it's designed to make it really easy to provide basic sepsis education to people that don't have a medical background and maybe aren't familiar with sepsis whatsoever. So we've seen folks using this, you know, in their book clubs or their community centers or, you know, Sunday school or other religious groups or things like that, anywhere that you have a connection to people to want to help, you know, spread sepsis awareness and familiarity with sepsis. This presentation is meant to be customizable, but also meant to be really kind of plug and play. You know, you can take specific pieces of it that feel relevant to you and leave ones that don't. But we really want to make it, you know, we want to remove all of the barriers that we can to that might feel difficult to spread awareness of sepsis and provide this basic education. So I think Julie already put the kit in the chat, which is great. Thank you, Julie. There, if you enter your information to download the kit, you'll find a slideshow and a script. There's a video you can choose to play. There's customizable poster, presentation promotional materials, and there's also a pre and post event quiz with answer sheets if that's, if you want to be able to measure the impact of what you're doing with your group. And if you have questions, if this sounds like something that you might be interested in doing, but you're feeling a little bit intimidated or not sure that what we have there is a good fit for your group, then we'd also love to hear from you. We want to help you. as much as we want to, we can't personally be in every single space that all of the people that we're connected to can. And so you all can really help maximize that impact and really, make this feel relevant and real to people. It's very different to have one of us maybe at an outreach event or something like that compared to somebody that folks in your community know and care about. And so we really do encourage you to use resources like this to reach your communities in ways that feel right for you. And with that, we're at the end of our formal presentation, but we're at a point where we're really excited to take questions from you all. I think I'm going to stop sharing my screen so that I can see the chat box a little bit better, but I'd love for you to enter any questions that you have into the chat, and we can take some time to talk about that. The first one I'm seeing is probably a quick one to answer, so I'll take that. This is from Emily, and she asks if we're allowed to print out flyers to distribute to staff and visitors. I'm guessing that this could have to do with a couple different topics, whether it's the Sepsis 911 presentations, whether it's Summit, whether it's general materials. But the answer, as far as I know, and please jump in if anybody has a different answer to this, the answer as far as I know, is yes to all of those. We really want all of our materials to be accessible. And so we discourage folks from, altering anything that we have put together, but anything that you can print and help us distribute further, I think that's a good thing. Julie, would you answer that differently?
Nope, that's exactly how I would answer it. We would love for you to share our resources with everyone you know.
Awesome. Yeah. And we even have something we didn't touch on today, but we have a lot of downloadable resources on our website that are more in-depth educational materials. And even those are designed to be downloaded and printed. So if you have a case where that would be helpful to you, we encourage you to do that as well. Another one about the Sepsis 911 presentation from Deborah. If there's a charge, there is not a charge for that. So that is free to be downloaded and used. And we're happy to help if there's anything that we can do to help you with that. From Jennifer, she says, with the Sepsis Alliance Summit, there was a QR code, but I'm not seeing it on the website. Is that poster available? Oh, Julie, you already got that. Never mind. Give me a second. You are all asking such great questions that I don't want to miss any. Janie, this is a question that I actually don't know the answer to. Hannah might be able to help with this. It's if we do community presentations, would we be able to claim continuing education hours?
Yeah, Janie, thanks for that question. We have not accredited the 911 presentation or the community presentations. There's a post-test involved in an evaluation. So at this point in time, there aren't CE contact hours available, but an interesting thought for us to ponder for the future.
Yeah. I think I have caught up with the questions in the chat, but if I have missed yours, please feel free to copy it and paste it again, because I'm thrilled with the amount of chatting that is going on. All right, well then I think we might have made it through all of the questions. I thank you all for bearing with us. I could feel myself talking rather quickly, so I apologize for that. I think my coffee was affected my pace of speed today. Okay, here's a couple new questions from Emily. If we create our own sepsis superhero poster, do we have to include your logo? Julie, do you want to take this one?
Sure. No, you don't have to include our logo, but you're more than welcome to include our Sepsis Awareness Month logo. And there's more information about how to download it in the toolkit. But yeah, you don't have to include our logo. You can take a poster board and create one yourself if you want. We encourage all involvement.
From Chandra, is anyone using a theme around their World Sepsis Day? Or I would expand that to say, or around Sepsis Awareness Month. Has anyone heard of anything like that? Or if anyone in the room wants to speak to that, you can answer her in the chat as well. But from our staff, has anyone heard of anyone using a particular theme besides that infection prevention is sepsis prevention?
I haven't, but I do think infection prevention is sepsis prevention is a really great theme.
Yeah, that's a new one for us this year to have to use that sort of broadly and intentionally. I don't know, Julie, if do you want to talk about where that came from and how that how we're planning on using that?
I believe that our medical director came up with it, and everyone was like, oh, that's amazing. That's great to really drive home the point that infections and sepsis go together. And so we are really excited to communicate that this year. And there will be all sorts of fun graphics shared on our social media this month with that tagline. So we're really excited to share that with you all and get the word out that infection prevention is sepsis prevention.
Yeah, this was our chief medical officer, Dr. Cindy Ho, who works at Jefferson, and she had been saying it. She is an infection preventionist by trade and had been saying it in meetings with us and in meetings with other folks, and it really just kind of sticks and it makes a lot of sense. So I do feel like that's a great theme.
Here's another sort of logo specific question. If we make our own superhero logo, do we have to include the Sepsis Alliance logo? Julie.
Hi. Yeah, no, you don't have to include our logo on your sepsis superhero challenge. I mean, we would love for you to, so that people know where to get the resources and stuff that we provide. But yeah, you don't have to. If you want to make it personalized to you and what your story is, we highly encourage that.
Great. Well, then, if that is all of the questions that folks are sharing with us in the chat, I just want to take this moment to thank my colleagues, Kate, Julie, and Hannah, for joining us today, as well as all of you who joined us for this program. This was our first time doing a kickoff program like this, and we thought it might be a good idea, but we weren't sure if people were gonna were gonna want to be a part of it or not. So we were really thrilled to see so many of you here today. Really thrilled that there are so many of you getting involved this Sepsis Awareness Month, and we really hope to continue to interact with you on social media and in all of the ways we described today throughout the month of September. So thank you all so much, and I wish you a wonderful rest of your day and rest of your month. Take care, everyone.